A private hospital has set up a 10-bed holding area in its undercover parking lot to cope with an increasing number of people seeking medical care in Pretoria. The Life Eugene Marais Hospital has bolstered capacity in a bid to limit any delays in treating patients arriving at its emergency unit. Against that backdrop, analysis now on the overall capacity and capability as we talk again to Dr. Angelique Coetzee, who heads up the South African Medical Association. Doctor, good afternoon to you. How would you describe current capacity?
Disastrous. That's all I can say. It's a disaster. There is not enough ICU and high care beds. I need to correct something. There was a claim yesterday by the NEC for helping KwaZulu-Natal that there are enough beds to cope with COVID-19 in the province. It's misleading because, she's saying that there is 66% capacity. The province is only 66% capacity. What she doesn't tell you is that they have discharged most of the chronic patients and the non-urgent patients, and the pediatric wards are also running at about between 20 and 40% occupancy, as well as the surgery and other departments. So obviously there will be 66%, but that beds is not the beds that is needed for COVID-19. And I think it's time that that the politicians start to tell the truth out there, and not to give you the half truth, but the whole truth. So the truth is, there is not enough ICU and high care beds. I want to see the province that still have it. Please, you can correct me if I'm wrong, and I will apologize. But as far as we know, in the private sector, they're also struggling severely, as you have said. Incidentally, Eugene Marais is very close to me, and I'm aware of what is happening there. The other hospitals, the Netcare hospitals, are not far behind. Very important to understand also that there's not enough personnel, there's not enough doctors and correctly qualified nursing staff to help with this pandemic, to address it. And what is very concerning is SAMA had said since October, we have warned that we will see the second wave during this time. And it seems to me there was a lack of preparation. So we are now again saying we haven't seen the top yet of this pandemic. It will only be seen and reached, I think, about 3 weeks from now on. But there will be a third wave coming in middle next year. So are we then again going to close everything, blame everyone else, except getting the healthcare system up to standards?
Dr. Coetzee, let me ask you this question. You use the word disastrous. At what point does the system collapse? How close are we to that?
Well, I can promise you the system is already starting to collapse by having not having enough beds. I know for a fact that there was the day before yesterday, a patient referred from Pretoria to Kimberley to get a bed. From Pretoria to Kimberley. How on earth does that happen? It's a private patient. The hospitals are really full, and these doctors are working really, really extremely hard. It's long hours. It's difficult patients to manage. And it's not only COVID patients coming in. It's other patients as well. It's your heart attacks. It's your diabetes comas that are coming in. It's other, and it's people with trauma coming in as well. So you have to cope with all of them. And there's skeleton stuff. So how do they cope? They can't cope. They can't. They are just going on and on and on. It's a huge problem.
Dr. Coetzee, what needs to be done right away then?
Well, first of all, the moratorium on MO posts in all the provinces, and every province is pleading poverty. They don't have money. They need to look and go and see where did they go wrong. Why is there not money to fill posts for doctors and nurses, the correct trained nurses in especially the ICUs and high care? That's the first thing. So it's an HR problem. The second thing that needs to be done, there must be enough oxygen ports. You can have enough ports, but also make sure that there's enough oxygen delivered to those ports. You have to make sure that your infrastructure in your hospital is up to standard, that there's enough masks, gloves, the correct sanitizing, the sanitizers, that there's running water, that the toilets are working. It's basic stuff. It's not in all hospitals working. There need to be support staff. It's not there.
Dr. Coetzee, as difficult a question as this is, you've outlined the systemic failures in the hospitals themselves. At what point is medical care compromised, given as well that you speak about skeleton staff and doctors and nurses who are exhausted?
It's already compromised because exactly of the fact that they are exhausted. And you have to also understand, patients can be extremely demanding, especially their families. So you are working very hard today. You have difficult patients. Then you're on top of it, you get people coming into the casualty or demanding families and thinking, you know what, they are the most important people in the world. Without saying, thank you, doctor, for what you are doing. Just a thank you to the doctor and the nurse, and showing your appreciation for the hard work that they are doing, instead of coming down on them and just demand. Just accept that we are saying for the last week that there's a capacity problem. So I want to say to the patient out there, it is also it also goes to you sitting there. You also are part of the problem. So please, let us just work together. Don't go unnecessarily to the ICU, to the casualties and to the hospital centres. Please make sure, if you've got a headache, take some tablets for the headache. It's no use running into a COVID hotspot. Each and every casualty clinic, pharmacy is actually a COVID hotspot. And please, let us take hands.
Dr. Angelique Coetzee, you paint a terrible picture, and I appreciate your honesty. Thank you very much for joining us today.